Hi, let's discuss hands-only CPR. Hands-only CPR is a lifesaver. Everyone should learn CPR, and I do mean everyone should learn CPR. Sadly, 70% of Americans may feel inadequate or helpless when it comes to helping someone that has had a cardiac or heart emergency. They either do not know CPR or they have let their training lapse, so they're unable to do it the way they feel is appropriate. Interestingly enough, 70% of cardiac attacks happen at home, or cardiac arrest happen at home. Simply put, this is very important. I want everyone to hear and understand this. Statistically, it bears repeating. 70% of all cardiac arrests happen at home. According to the American Heart Association. Who is the American Heart Association? Well, what do they have to do with anything? They are the leaders in developing and implementing life-saving techniques, such as CPR or cardiopulmonary resuscitation. That's what CPR stands for. This life-saving technique is done when someone goes into cardiac arrest. What is cardiac arrest? Well, cardiac arrest is when your heart stops beating for whatever reason it may be. So, if you see an adult who is unconscious, they're not breathing, or they're not breathing normally, as most people would recognize probably that you're not breathing normally, first you need to call 911. And then you need to perform hands-only CPR, which means you will push hard and fast in the center of their chest. So I'm going to enlist my friend Ed here again for this discussion, and say we're at home visiting and Ed has an issue. I don't know what the issue is, but he ends up going unconscious and he's not breathing appropriately, and then he stops breathing altogether. So I am going to do hands-only CPR, which means I go up to Fred and he's probably laying on the floor or on the couch. Most likely he's collapsed and fell on the floor. So we're going to push hard and fast in the center of his chest. Both hands, and just hard and fast in the center of his chest. This keeps the blood flowing that already has oxygen, keeps it circulating in his body until the ambulance can get here, because you've already called 911. It's very important. We want to keep Ed's blood circulating for as long as we can. Cardiac arrest happens more often than you think. They can happen at any time, anywhere. We have to get past the mentality that it won't happen to me. It won't happen to my family. We are indestructible. We don't need to know these things. Well, yes, we do. Each and every one needs to know hands-only CPR. Why do you want to take that chance of not knowing? There are 350,000 out-of-hospital sudden cardiac arrests that happen every year. 70% of these occur at home. Many victims appear healthy. They have no known heart conditions, no underlying reason why you might think, okay, he's at risk. I need to know this So in case he happens to have a cardiac problem, I can help. 4 out of 5 cardiac arrests are at home. That's a huge number. So statistically speaking, the life you save is likely going to be someone in your own home. Your child, your spouse, brother, sister, mother, father, friend, anyone. Failure to act in a cardiac emergency can lead to unnecessary deaths. Effective hands-only CPR provided immediately after sudden cardiac arrest doubles or triples the survival rate for your loved one or for anyone. If it's your loved one, you should want to give them that chance. Only 46% of cardiac arrest victims get hands-only CPR. Unfortunately, only about 10% of people who suffer cardiac arrest outside of the hospital survive. So is hands-only CPR safe? Yes, it is. It is safe for the provider. It is safe for the victim. There is no mouth-to-mouth resuscitation, no breathing, no coming into contact with bodily fluids or all those things that everyone seemed to be afraid of before. So it makes it safe. You should want to help. According to the American Red Cross, they support compression-only CPR due to scientific evidence. The Red Cross uses the term compression-only CPR, while the AHA uses the term hands-only CPR. Two different terms, but still the same name, hands-only CPR. It can be learned in 2 minutes. This procedure is simple, easy to learn, and most of all, it could save a life, a loved one, your family member. Additionally, according to the National Handling Network, heart disease is the #1 killer of men and women. For every minute that CPR is not being done, the victim's chance of survival drops by 10%. So think about it. You could save your loved one's life. You could help them. What chance are you going to take? I'm going to make that choice.